Malaysia's COVID-19 death toll has reached 24,681 after the Health Ministry reported 116 more coronavirus deaths on Thursday.
Based on the ministry's GitHub data repository, 1 out of the 116 deaths occurred on Thursday.
The rest were backlogged cases in June and before, July, August and September.
Of the reported deaths on Thursday, 29 were fatalities classified as brought-in dead cases.
This brings the total of BID cases in the country up to 4,838.
Based on the latest graphs on the ministry's COVID Now website, the country's death cases were still on a declining trend.
The average number of deaths in the last 7 days, based on actual date of death, was 92.
This was a decline from early August, when the average was around 300 death cases a day.
Out of the 116 reported deaths on Thursday, 50 of them were Klang Valley cases.
Putrajaya, Johor, Negri Sembilan, Pahang, Perlis, Terengganu, Labuan had no new reported deaths.
On Thursday, Malaysia reported 13,750 new COVID-19 cases and 16,628 recoveries.
Recoveries had outnumbered new cases for 7 days in a row.
Active COVID-19 cases in the country continue to go down, with the latest number at 198,284, a further reduction of 2,990 from the previous day.
Of the total active cases, 165,421 or 83.4% were patients with mild infections and were undergoing home quarantine.
Another 21,350 were those under isolation at low-risk quarantine centers, while 10,396 were hospitalized.
There were 1,117 patients in intensive care units, including 615 who were on ventilators.
The national ICU utilization rate was currently at 75.9%.
With 75 ICU beds utilized in Penang, the state's ICU utilization rate was at 99.2%, the highest in the country.
The Klang Valley's ICU rate was at 78%.
States with ICU usage rate below 60% were Malacca, Negri Sembilan and Labuan.